Now, a lot of comments about gallbladder and liver problems. I just want you to stop and realize that the gallbladder and the liver is nothing but cells and two fluids. Doesn't matter what their performance or function is, such as bile for fat breakdown, stuff like this. You really have to understand that it's your lymph system that breaks things down, whether it's in the liver. And generally when you see it in the liver, it's also in your bowel wall and probably in the brother next door of the pancreas. And so even at a low level, you could have some hepatitis or inflammation in the liver and in the pancreas, some pancreatitis, and maybe some enteritis in the small bowel. This all kind of goes with that, even though sometimes you don't feel things. So to restore these, you can always use a liver formula, a pancreatic formula, but I want you to always think that behind that, these herbs are great to enhance the function of the cells, but behind that is the lymph system. And that lymph system is what's breaking down these tissues. So it always comes back. Isn't that interesting? It always comes back to this gigantic sewer system. And what happens when the kidneys can't filter it? And what happens when acidosis is allowed to stay in the body? And that anionic effect, that dehydrating, coagulating effect of this fluid that makes it so hard to move out. And it's a mucousy fluid. And you've seen that if you've gotten thickened mucus out of the sinuses or lungs. Just what happens when that fluid is allowed to get acidic too long. And of course that's just locked around the cells. Put a big blanket over your head and tie it there and see if you can breathe well. And that's what we're doing to our cells when we're backed up like that.